Welcome back. You're watching McLaren Port Huron's Today's Health, and in this segment we're going to be talking about shingles with board-certified infectious disease specialist John Brooks. Okay, Dr. Brooks, switch gears here. What is shingles?
Well, shingles is interesting because it's a viral infection. We just talked about a virus, so it's another one. They like to invade us. But what's fascinating about shingles, it's the chickenpox virus, and that's the thing that people can say it is. So the virus that causes chickenpox is called varicella zoster. So most people, at least anybody now that's been born in the last about 20 years, they've been vaccinated. So kids are vaccinated for chickenpox, so they really don't see it. But those of us who are older, we all had it when we were kids because chickenpox was so prevalent. And that's the problem. So adults had chickenpox when they were kids, and that virus, that varicella zoster, goes to sleep. And it goes to sleep deep in the neurons along the spinal cord. They're called ganglion. So the virus is deep asleep in there, and when we get older, usually late 50s to early 60s, when our immunity to the virus has waned, it's kind of gone to sleep and it's not working anymore, the virus wakes up. And when it wakes up, it crawls out that nerve and goes out into the skin and causes a blistering rash.
So blistering rash is one of the symptoms. What else?
So the blistering rash, regretfully, is usually very painful, which is one of the biggest problems we have with shingles. And what's fascinating is that there are many people, how about several people every year in the United States, they get taken to the operating room because they have abdominal pain. So they go to the emergency room and they have this terrible abdominal pain. They do a CAT scan, they don't see much, and they're worried that they have appendicitis. So they take them to the operating room, they open up, their appendix is normal. A day after surgery, the shingles rash shows. So what was going on is that the virus is coming out through that nerve that's on the belly wall and the abdominal wall, and it feels like there's something bad going on inside, what's actually in the nerves. The virus is actually damaging the nerve as it's making more of itself and coming to the skin. And as it damages the nerve, that's what causes the pain. The rash that starts is a blistering rash, so it causes vesicles, which look like blisters. They're fluid-filled sacs. They tend to be in an area called a dermatome. When you think about your body, when you touch yourself here, you feel there, not the tip of your toe, because we're put together in pieces. We have little areas where the nerves feel in like segments. If you ever think of, go to the grocery store and they cut, lunch meat, right, they take slices. Well, that's how our nerves are through our body. They're in different segments or different slices of us that go through from piece to piece to piece. So the nerves that go to an area, that is the part that gets involved when the virus is waking back up. So that whole area it comes to is what gets affected. When you think about your abdominal wall or your belly wall, it's about that wide and goes from the back all the way to the front. So there's a pretty large swath where the vesicles show. So there's a large area of the rash that's painful, that becomes draining until it dries up.
Can you spread shingles?
So the answer is technically yes. Now, the important thing to know about shingles is that it's the chickenpox virus. Now, let's say I'm 6 years old and I wasn't vaccinated for chickenpox. If I get the chickenpox, it's a respiratory infection. And that's an important part to understand about chickenpox, is that we think about the rash that it causes, but really it's a respiratory infection. We inhale it in, we actually get a mild pneumonia, we get an infection of the respiratory epithelium, so the nose, the back of the throat, and the upper part of the airways is where the virus is replicating. We cough it out, and the last part is when we get the bumps on our skin, when we get the vesicles, and that's chickenpox. So what happens is that with varicella zoster, it is that virus. So if I'm not immune to chickenpox and I touch your vesicle that has fluid and inoculate myself, touch my eyes, my nose, the back of my throat or my mouth, I can then give myself chickenpox. So if you have shingles, you cause chickenpox, not shingles. Because shingles is the reactivation or the coming back of the virus that's gone to sleep from years ago. So it's not shingles to shingles, it's shingles to chickenpox.
So if I have shingles, is there any way for me to prevent giving you chickenpox?
So the answer is it takes direct contact. Unlike the original chickenpox infection, let's say that kids used to get, that's virus, that's respiratory. So when they're breathing it out, it's in the air, other people can breathe it and touch it and bring it in and they get infected and they get chickenpox. When you have shingles, it actually is what we call direct contact. Another person has to contact the drainage from those vesicles on the skin and then take it from there and put it on themselves. So it is possible, but if we cover those lesions and keep them good and clean, we don't tend to give it to other people.
How do you treat shingles?
Well, fortunately, shingles is something that is treatable with virus medicine. We have an antiviral medication. There's actually 3 of them that work very well. They're highly effective, but there is a trick. If somebody has the new onset of shingles, they don't have days or weeks to seek therapy. They need to see their physician rapidly. If they can get to the doctor within 3 days, the medicine is highly effective in stopping the virus and making them have less troubles from the virus afterwards.
Well, if you believe the commercials and your description, shingles is something you want to avoid. So can it be prevented?
So the answer is that hopefully, as you said with the commercials, you're talking about a vaccine that is available. There is a vaccine for shingles, and it's actually a version of the chickenpox vaccine we give the kids. It's just a bigger dose because adults are bigger than kids. So it actually recalls the immune system. It gives it a boost. It says, hey, you've seen this before. Now here you go. Bring your immunity back up. So that virus that's sitting and sleeping back in those ganglion doesn't have a chance to wake up and come back out and cause the shingles. So a way to prevent it, right now the age of 60 and up is who's available for the vaccine. They're eligible for the vaccine. They can get that. Of course, McLaren Port Huron Pharmacy Place can give it to them, or their primary doctors can give them the vaccine. If they're Medicare, I know it's covered by Medicare, so that's helpful. So they can prevent the infection from coming back.
So that is a vaccine that is even though we see in a lot of commercials, that makes us wonder, should we really get it? But you're saying yes, the shingles vaccine is a good.
If you are over the age of 60 and you've not had shingles already, the answer is it's very helpful. Some of the authorities are now saying if you even had shingles, maybe you should get the vaccine anyway to prevent it from coming back again. It is pretty rare once you've had shingles to get it again, but some people do. Now, the one thing about the shingles vaccine, it is what's called a live attenuated virus, which means that if you're immunocompromised, so if you have HIV or if you have cancer on chemotherapy, you're not allowed to have the virus. You're not the vaccine.
Great information. We're going to take a break and come back and talk about Lyme disease.